Welcome to Nursing Education in Crisis, co-sponsored by the Middlebury branch of the American Association of University Women, otherwise known as AAUW, which is way, way easier to say, and the Ilsley Library. We're so grateful for this partnership on our speaker series with Ilsley Library we've had for the last couple, 3 years. I'm Mary Longy, co-secretary this year with Kathy Skubikowski for our branch. The AAUW is a nonprofit organization founded in 1881 with a membership of over 170,000 people. Its mission is to advance gender equity for women and girls in education, the workplace, and women's rights through research, education, and advocacy. The Middlebury branch was founded in 1922. So yes, we recently celebrated our local branch's 100th birthday. We meet once a month from September through May. We mentor area college women with middle school students, and for 3 years now have sponsored a speaker series open to the public. For more information about AAUW in general, you can go to aauw.org. And if you have questions about our local AAUW activities, you can speak directly with me. Leanne Barrera is our treasurer, and Straub is our president, who's not able to be here tonight. And there's a sheet over here that has our contact info on it, or just see us afterwards for that. We also just do one fundraiser a year that raises money for graduate level education for women. And it's a raffle, it's a choose your own raffle, so you just choose which things you might want to win. So therefore, if there's a gym membership and that's not something you're interested in, you just don't choose that item. There's a beautiful painting by one of our members, Clara Calitri, over there, which is one of the prizes, some photos of other prizes, and a sheet with all of the prizes and some raffle tickets in case you're interested tonight, or just take one home with you. We are very pleased to have with us this evening Dr. Annie Moore Cox, PhD RN, who's been a nurse for over 35 years and an educator for more than 25. Her research interests are in the intersection of nursing, communication, and technology. And that's a lot to be putting together. Annie currently works for ATI Nursing Education as a solutions strategist, coming up with new ways to help nurse educators improve student outcomes. A Vermont resident, she used her role as president of the Vermont Organization of Nurse Leaders to jumpstart Vermont nursing informatics with co-founder Julie Jones in 2011. Annie lives in Middlebury with her husband Matt, surrounded by a large garden and a menagerie of animals. We'll have to ask what all those animals are sometime. A steady supply of new nurses is needed in the U.S. to replace those who leave or retire from the profession. And while there had been a steady growth in nursing school enrollments through 2019, as you can imagine, since 2020, enrollments, numbers of newly licensed nurses and numbers of nurse educators have all declined substantially, a worrisome trend. Negative social media posts by nurses, reports of violence against nurses during the pandemic, reportedly low salaries, and frequent reference to burnout may be pushing college-age students away from a career in nursing. Dr. Moore Cox will discuss these issues along with the strategies to combat them. The format for our time together this evening is a talk by Dr. Cox, followed by questions and comments ending at about 8 p.m. So without further ado, let's welcome Dr. Annie Moore Cox. Oops.
Super. Thank you. Great. Well, thank you, Mary, and thank you all for having me. I'm thrilled to be here. As a nurse and nurse educator, we're evangelizing, if you will, trying to spread the word, frankly, about the crisis that we feel we're facing in nursing education. I know the paper talked about this as a discussion about nursing, but really the pipeline for nursing is nursing education. And right now, as a result, mostly of the pandemic, I think we're headed down a really unfortunate path. So tonight, I'm hoping that what you'll get out of this is an understanding of nursing education, because it's kind of convoluted, and also some of the issues facing nursing ed and the nursing workforce in general, and some thoughts about what the federal and state governments are doing, and what you might do. So that's my goal Anybody have another goal? Just wanted to start with some background. Because I think a lot of people get confused. The word nurse gets sort of bandied around quite a bit. And, what's the difference between an LPN and a nurse practitioner and an RN? So I thought, we could sort of, to use a business phrase, level set. All my friends in my company use that word, level set, reach out. So the U.S. nursing workforce is made up of RNs, LPNs, nurse practitioners, and so forth. But the largest number is registered nurses. And the U.S. Bureau of Labor Statistics has projected a need for an extra almost 200,000 new nurses every year for the next, from 2020 to 2030. So let that stick in your mind, 200,000 to replace those who retire, as well as to increase the current suite of nurses, because as a nation, we're aging. The US is an aging country, and pretty soon we'll have more people over the age of 65 than we will below 30. So that's a dilemma, because folks who get over 65, 75, 85 tend to have more chronic illnesses. And with chronicity comes more of a need for nursing and healthcare. And while I'm sure many of you have had experiences in the healthcare system, but a lot of younger people don't realize that it's not like Grey's Anatomy, where the doctors do everything. It's not like that at all. So it's really nurses who are the eyes, ears, mouths, if you will, hands of the healthcare system for patients in hospital as well as in home care. So we're vital to the system. We're over 3 million strong in this country. We're the largest workforce in the healthcare system. So we're pretty vital, I'd say. But we're getting old. The median age of nurses is 52. So that's not good. So, and hold that thought, because it gets worse. Salaries used to be kind of terrible, but now they're not too bad, 77,000 average. But don't forget, that includes nurses who've been at it for 40 years, because there's a large cohort of nurses in their 60s, all the way to nurses who are just starting out at 22. So that's the average salary for nurses, and across the country. In South Dakota, the average is 60,000, whereas in California, it's 125. So you can see there's quite a diversity. Here in Vermont, it's about 72. That's the average. However, the pandemic opened a really interesting door for nurse salaries. I don't know if any of you have been in the hospital lately, but I was at Porter for a surprise appendectomy about 6 weeks ago. And just out of curiosity, I asked every nurse I encountered, from the ER right through to recovery as I was getting discharged, are you a traveler? And every single one said yes. Everyone. That's 5 nurses I talked to. And some of them are local. I know them. Yeah. So that means that they signed on with a travel agency, but they're working part-time over at Porter, or working for Porter in a 3-month gig or something like that to make a lot of money, because they can triple or quadruple their salary. So why wouldn't they, right? But you can imagine what that does to a nursing staff, how demoralizing that would be. The person next to you is making 3 times what you're making. One of my daughters had a healthcare incident this past spring, and every nurse that took care of her was a traveler. And this was in a labor and delivery suite. Yeah. So it's all over, very pervasive, and it's a real problem, even here in Vermont. Even Bernie Sanders commented on it. I think, don't quote me on this, but I'm pretty sure he said about $25 million has been spent in the last 2 years on extra salaries for nurse travelers by the healthcare system here in Vermont. So that's an outrageous amount of money. But think about it, if you were a nurse and you had been paid $65,000 to do a job that was nights and weekends and required 4 years of education and continuous education, and maybe you even had a master's degree and yada, 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 and suddenly you could make 180, why wouldn't you? So anyway, not good. Yeah, I know. And we kind of joke about Florence. I used to wear, when I first got out of nursing school in 1985, I wore my cap and a kind of a midi skirt, like white skirt, and they called me Flo over the loudspeaker. Flo, can you get the patient in 35, please? But really, we owe a huge debt to Florence Nightingale. She really is the mother of modern nursing. And not because she's the lady with the lamp. It's not this very romantic vision of her. What she actually brought to the table was an incredible facility for statistics. Florence Nightingale found out through statistical analysis of the Crimean War Hospital, where she fought to be, that patients were dying not from war wounds, not on the battlefield, but from terrible hygiene. It was built over, the hospital where she was built over an open sewer. Yeah, there was no clean water, and so infection and so forth, and the men were close together. So she actually tremendously cut the number of deaths in those hospitals where she was, and then brought those ideas back to England with her when she returned. And being a woman of means, she came from a wealthy family, she actually was able to have a voice to people who might make a difference, and she really did have an impact. Then she started a school that was very scientifically based on her ideas. Florence Nightingale didn't believe in the germ theory. That was before we understood what bacteria and viruses were. But her ideas about fresh air, attitude, hygiene, cleanliness, really are, as we approach the age of antibiotics not working, they're more important now than ever. So, and she would have been aghast at the way we handled the COVID pandemic. So we really do owe her a huge debt. Not long after Florence's work starting a school in England, we did the same here in the US at Bellevue Hospital. A lot of famous nurses I should be naming, forgive me, who really did tremendous work getting these ideas into the United States. In the 1800s, late 1800s and early 1900s, students were actually the nurses of every hospital. There weren't staff at the hospital. It was students who were in school, who were paying to be in school, who actually staffed the hospitals, morning, noon, and night. Once you graduated, you went on to a private duty assignment. So you would become a private duty nurse and either get hired individually or work, get sort of referred by an agency or something like that. So the nurses who were working in hospitals, which weren't great places to be at the time, really were students, were young and very abusive, as you can imagine. And also, I think it really set up a system, a very patriarchal system, within the US healthcare system. So I think because physicians were the ones bringing in the money, and hospitals were sort of abusing these student nurse, this free, well, not free, they were paying to work there. It kind of set things up a little bit on the ugly side. By the 1930s, we were also working towards a standardized curriculum in school, because at first there was none, and then transition from private duty to hospital-based staff. So that's when nurses started to become staff nurses in hospital. And that's, really nurses started intensive care units. It really, that's when things really started to grow in terms of nursing care in the hospital. And in the 1940s, although there were already some university programs in nursing, really nursing started to move into the academic setting. And the 1970s, because of, I just find this incredible, because of a Columbia Teachers College graduate students' dissertation on the possibility of educating nurses in 2 years in the associate degree programs throughout the country. We now have community colleges with associate degree programs. She really started that movement. And I I'm not sure it was the best thing, because it really reduced us as a profession to a 2-year degree. 75% of the nurses that in my cohort that I went to, I actually had a bachelor's degree and then went back to school for a 2-year degree. And 75% of nurses when I graduated from school were associate degree nurses. That has changed now. More than 50% of nurses are baccalaureate prepared, but that gives us a bigger voice at the table, as you can imagine, and it enables you to go further in the profession. So, that's definitely something we've always been fighting. It's a fight, who knows. Now the pendulum is swinging because there's a workforce issue, and I'm hearing they want us to start a 2-year school. They want us, the hospitals are starting 2-year schools. So I'm hoping that's not going to happen, but we'll see. So LPNs, or LVNs, or PNs, licensed practical nurses, they are, again, increasingly large proportion of nurses. For a long time, they were getting shoved out of the hospitals. They weren't being hired. Now they're being hired again. And they work under the auspices of a registered nurse. They have usually a 12 to 15-month program. And some of them are even high school based. I have one customer in New York City that's a high school nursing program. Clara Barton, which I love. One of my daughter's names is Clara. And then registered nurses, which is what I am. And there are still in fact, there's a lot of hospital-based programs. You'd be surprised. They now have to offer a degree. So they have to collaborate with some kind of a college to offer a degree. But you'd be surprised, especially in the Pittsburgh area. I don't know why, but there are a ton of hospital-based schools. And you're seeing more interest in that because the hospitals are desperate. Then associate degree, which tends to be community college based. Vermont Technical College offers an associate degree. They have an interesting program. It's a 1+1. You actually go in, you become an LPN, you go right to finish your RN in a year, and then they actually now have a BSN completion program. They just started that recently. Baccalaureate degrees, Castleton is a 4-year degree, Norwich 4 years, and so is UVM. They're also now post-baccalaureate degrees. So you have a bachelor's degree and you take some prerequisites like microbiology, anatomy and physiology and so forth, and then you go right into a nursing program, and some of them are 11 months. If you could, mind-boggling. But they're anywhere from a year to a year and a half, sometimes a little bit longer. I know Norwich's is a little bit longer. And then APRNs, advanced practice nurses, they're your nurse practitioners, anesthetists, midwives, and that requires now a doctorate. Actually, you have to go on to get a DNP to get a degree like that. And in terms of graduate degrees, you need to have a master's in order to teach, and that's to have a faculty position. To be a clinical, to supervise in the clinical area with students, you have to at least be on the road towards a master's, enrolled in a master's program. DNPs are the other big degree now. That's just relatively new, Doctor of Nursing Practice. It doesn't require a dissertation. It's a shorter period of time. It's really a clinical degree. And a PhD, that's what I have, but mine is actually in education, curriculum and instruction, and EDD, and then nursing doctorate. So there's all kinds of ways to be a nurse. It's mind-boggling, I know. So now we're on to the challenges. So remember I said 200,000 more a year, right? That's about 100,000. So, and that's from 2020 to 2021. We lost 100,000 nurses. So there's no way we have the educational capacity to make up for that year, because the most scary thing is that most of them were under the age of 35. So we're starting with a real deficit, starting out heading towards 2030 with a real nursing deficit. And if you take anything away from tonight, it's this, that we have we're starting with 100,000 deficit from 2020 to 2021. There's no way to make it up with the current set of nursing programs and schools and so forth, the way we do things now. So what happened? because I'm a nurse and I'm on Instagram, I saw a lot of very negative from nurses, very negative and honest discussions of how upsetting it was to be a nurse during the pandemic, how angering it was to be taking care of people who were dying and still didn't believe in COVID. The frustration that nurses felt that they were bringing this home to their families, that they could get sick, and many nurses did get sick. Many healthcare workers died from COVID. It just didn't seem fair, and nurses are angry. They weren't happy to start with because of working conditions. The pandemic just exacerbated that tremendously. A lot of nurses feel, this is by the way, nurses, ICU nurses who showed up in silence at a rally to protest mask mandates and vaccine mandates. And that happened all over the country. Nurses showing up and silently protesting, counter-protesting, I should say. It felt like, when something like this happens, everybody gears up and, you're sort of, ready to fight. But then when it goes on for 2 years, and then 2.5, and now 3, I think you lose your will to fight. Now we're looking at another wave this fall. 300 people a day are still dying in this country, and there are nurses taking care of those people. So it's not over. And we're seeing a lot of people come back into hospital now who delayed treatment because of being afraid to come in for COVID. So people with severely, compromised limbs, hips, joints, people with heart disease, lung disease, cancer, who delayed treatment. So there's a lot of very sick people walking around as a result of the pandemic that had nothing to do with COVID. Well, everything to do with COVID, right? And the anger, moral distress. The American Association of Critical Care Nurses, CCRN, Critical Care RN, did a survey in 2021, and they found 92% of those surveyed that they felt the pandemic would shorten their nursing career. 66% said they were considering leaving altogether, and the majority felt that the unvaccinated put nurses and their families at risk. So there was a lot of anger. And I just wanted to share this because I thought it was beautifully done. This is from a nurse. It was in Scientific American. I was angry at everything. Angry at the systemic failures of the government to act, angry at the individuals who treated COVID as a joke, and angry at the disinformation that ushered in more death, because it's nurses that took care of people as they died. And it was a lonely, horrible death. So this is Vermont. And I think this is pretty disturbing too. So remember I said average age is 52. So, 65, you think people are going to start thinking about retiring, even nurses. And there are fewer nurses under 35 than over 55 in the state of Vermont. That's not good. That's not good. It really should be a pyramid, like it should be like that, right? So this is from the, we do a workforce survey every 2 years. In order to renew your license, they actually funnel you off to this workforce survey. You sort of have to take it. And it's from AHEC. I forget what AHEC stands for, but they put this data together every year. So this is from 2021. And I thought, ew, when I saw this. It really concerned me. There are 4 programs in the state, as I mentioned, Castleton, Norwich. We lost Southern Vermont. That was a nursing program about 4 years ago, I think, and BTC and UVM. And VTC and Castleton are merging. I don't know if you're aware of that. So there will be 3 programs actually in the state. Castleton and VTC are planning to continue to offer 4-year baccalaureate to, the 1+1 plus the baccalaureate continuation program. So we'll see how the merger goes. It's going to be interesting. So, and here are so NCLEX passers. NCLEX is the National Council Licensure Exam. That's what that stands for. Every nurse who graduates from nursing school has to be attested to test. Basically, they have to hand in their transcript, and somebody has to say, yes, they passed their clinical and so forth and graduated from an accredited nursing school, and then the state allows them to take the National Council licensure exam. And the exam is difficult, as you can imagine. It's an adaptive test, so they start out with a level question, and then depending on that answer, they go up or down in difficulty. Students used to be able to have as many as 275 questions and as few as 75. They shortened the test during the pandemic. They swear that it hasn't, had an impact. Now I think the maximum is 150 questions and the minimum 70. So students can take the test a little more quickly now. But in 2019, there were 286 students who passed in the state, 314, and then again, the numbers are down in 2021. The pass rates have declined significantly through the pandemic. We'll talk about that more. Oh, here we go. This is so this is national. So remember I said 200,000 new nurses, and we already lost 100,000. This is how many nurses are coming out in the pipeline. About 170 in 2019 took the test, about 150 passed. So we had a pass rate of 88% in 2019. More students actually took the test in 2020, but the pass rate was lower, 86. It was the first pass rate lowering that I've seen in the time that I've been paying attention, 0.57. Unless they dramatically change the test, which they're doing next year. And then in 2021, the pass rate plummeted to 82.43. So even though more students took the exam, in 2021, many more students failed it. And if you fail the exam the first time, that's one thing. If you take the exam again, the pass rate is in the 40s or lower. So the exam does its job, basically. It does weed out those who know from those who don't. And so, and even on the second try, those who don't, on the first try, don't do much better. So that's kind of scary, because that's not enough nurses to fill the gap that we need, right? That the U.S. Department of Labor says we need. So pipeline is another business term. I love that. So in sales, the pipeline is this the vast number of opportunities that a salesperson uncovers, and it goes down like this into the pipeline of possible sales. So I thought I'd share. I've learned all this lingo over the years. So the pipeline problem is this. We know we need 200,000 nurses. We don't have the capacity in nursing schools. And the reason for that is there aren't enough nurse educators. Because, and I'll explain that in a minute, quality of students has declined. And I'll talk about that in a second. And the quantity of students has actually declined. Enrollments in general are down nationwide across the board in colleges and universities, and especially in community colleges. So if you look at capacity, so nursing schools, a lot of, in fact, it's interesting right now, there are 4 schools in Massachusetts, or in New England. They're traditional baccalaureate liberal arts small colleges that are probably suffering terribly. And financially, they're starting nursing programs, which I think is so interesting. Now they're starting nursing programs. The problem is there aren't enough nurse educators with masters and doctorates to teach on the baccalaureate level to staff them. So they're starting these programs with 1 or 2 people who are working their tails off, and that's why they hire my company. And the students also have to go to clinical. So nursing education is didactic. There's lecture period, usually a few hours a week. There's laboratory where actually students, and the laboratories are hilarious. They're beds, just it looks like a hospital. And the students have to learn how to practice before they go out into the hospital. And there's also clinical. So clinical is where they practice with real patients in the hospital with a nurse educator who's supervising them. So most hospitals don't allow more than 6, in Vermont, more than 6 students at a time. So if you do the math, if you've got 48 students in your class, you've got to have 8 educators for 6 student groups. Is that right? Yeah, 6 times 8 is 48. So that's expensive, and it's difficult to find those people. So clinical has gotten cut back. Also, I should point out that during the pandemic, hospitals wouldn't let us in. We were the first ones kicked out of the hospitals during the pandemic. So there were whole cohorts of students, especially in metropolitan areas, that barely touched a patient before they graduated from nursing school. They did everything in simulation. I could tell you where not to get sick, just come up later. So, part of the problem is salaries. I used to say I worked at Castleton for 2 years as a master's prepared educator with, probably at that point, 15 years of practice as an educator, all but dissertation. And I was paid less than my students would make the day they graduated. And I told them that. I thought they should know. So I worked at Porter in the summer and on weekends and holidays to make up the difference because I had a family. So I couldn't keep doing that. So that's why I'm not doing that anymore. And there are lots of people like me. You can get an APRN, an advanced practice midwife, nurse practitioner, nurse anesthetist degree, and make twice what the average nurse educator makes. So why wouldn't you? You're still working with patients. You're still doing what you love to do. What would draw you to education? There's a lot of thankless ugliness in education because one of the things that nurse educators are beholden to is producing safe nurses. So you've got a college or university that's trying to increase enrollments because they need the cash. And then you've got, on the other end, a public that's trusting you to graduate a safe nurse. So that's the central tension, really, of nurse educators and the nursing education business. And we don't always win. And that's part of the reason the pass rates are down, because we don't always win. Thank God for the licensure exam. Here in the state, Bernie Sanders and Moulton, I forget, I should remember this, but somebody named Moulton was quoted a bunch of times in this article that I read. He held a press conference and, he said, nurse educator salaries are abysmal, they are. That part of the problem is too, a lack of childcare here in Vermont, and we're not alone. Lack of affordable housing and transportation. You're a nurse, you're gonna have to go in the middle of the night to 10:30 at night to travel to work, to do shift work. So that's kind of a hard time to travel when you're living in Vermont. So the average faculty vacancy rate has been 8 to 9% for more than a decade. Ever since I can remember, that's what it's been. So that's, if you've got UVM, for instance, they've probably got 10 full-time. They're down 1 every year. And you need to have somebody in each specialty. So that down 1 might be your peds person, your pediatrics person. So now you're having somebody who doesn't have that specialty teach pediatrics. Or you have to get an adjunct, and you really don't know about the quality. They're not invested in the school the way the full-time folks are. And there are very few graduate nurse educator programs. When I was at Norwich, that's one of the things we did was start a nurse educator track in the master's program at Norwich. And I was particularly proud of that. They kind of went kicking and screaming because they didn't think they were going to make any money, but we did it anyway. And the other thing is the workload. It's not like being a professor in another discipline. You really have to do clinical. You have to keep up your clinical skills in order to teach students. So you do have to work weekends and summers, at least occasionally. You also, there's a tremendous amount of pressure because they're high-stakes exams. Every 3 weeks, students are taking very difficult multiple-choice high-stakes exams. And then my company sells these god-awful proctored exams that are standardized and makes it even worse. So, yeah, so it's not easy. And you have to be accredited in order for your students to be able to go on someplace, and sometimes even to be hired. And the accreditation process is onerous. So anyway,
Do colleges help pay for your, the continuing education that the nurse educators have to do?
It depends. In my experience, not very much. Yeah.
So they're not paying them well, plus they're having to pay for their continuing ed out of those small salaries rather
Right.
than getting support from their colleges and universities.
Right. The comment was, do colleges and universities pay for continuing education for nurse educators? And the answer is not always. It depends. It depends on the university. And also, some faculty are unionized, and then that's written into their contract. So, quality of students is another big problem right now. We're seeing students who just seem to have forgotten how to be students. When I say that to my peers, because I consult and I go around to a lot of different schools, everybody nods their heads. It's disturbing, all the online learning that they've done through high school, through the initial, science courses, taking anatomy and physiology online, microbiology online. They've never touched a Petri dish. It just doesn't seem like a reasonable thing, right? And they've gotten a pass because people were afraid to fail them. Colleges were worried about, it's such a different experience, and this was also new. If we fail them, couldn't they turn around and sue us? And that has happened. So remote learning has been something of a nightmare, and remote testing. So again, a lot of nursing schools, all nursing schools, have frequent testing to be sure students are capturing what they need to know and prepared for that licensure exam. And those proctored tests, they ordinarily, there's a faculty member in the front of the room and everybody's got their computer open and that faculty member is walking around making sure people aren't cheating. They all happened at home. And despite big efforts with remote proctoring software and videos getting sent to faculty and so forth, again, I would send videos to faculty and say, your student was caught taking pictures of every single one of your questions. And they would say, we can't do anything about it, because they'd get sued. Depends on the school, depends on the strength of the administration and so forth. So this has been I'm telling you, I'm retiring in July. Can't wait. There's another good reason for that. And high school students are very underprepared. They were beforehand, it's even worse now. Colleges have gotten rid of standardized testing like the SATs because they couldn't administer them during the pandemic, so they've gotten rid of those requirements. Well, it's a lot of what nursing schools depended on for admissions. So while the American Association of Colleges of Nursing say there's 92,000 students a year, qualified students a year who are turned away from nursing schools, I beg to differ. That's not what I'm hearing. I'm hearing they're having trouble filling the seats with qualified students. And I don't know if that's because post-pandemic our enrollments are down, but that's not what I'm hearing. So I don't know. Students have very interesting attitudes towards work and towards doing their own work. They don't seem to understand what cheating is or what plagiarism is or what working together means. They don't seem to understand that anymore. We had a student at a school who was caught taking pictures and on a cell phone while he was being proctored, so he knows he's actually had to take his camera and show his room, right? And show everything and take a picture of himself. He knows there's a video camera. He's taking pictures of the exam questions. He's already graduated. This is a program that prepares students for the NCLEX, and the idea of the assessment is to find out where your weaknesses are, and then we, as our company, gives you remediation so you can get better and try again, take another quiz. He's cheating on that. And, you know, where do you go with that? I just, to me, it was mind-boggling. Anyway, yeah. So all of that leads to these low pass rates. So the schools where I've seen the most cheating have the lowest pass rates right now, and it's criminal. And in terms of quantity, again, those negative perceptions about nursing, college enrollment's down, high salaries and easier jobs. You know, when you can make $17 at McDonald's, why would you go be an LPN? You're not going to make that much more. You know, so, you know, as an RN, you can probably do something in customer service where you sit at home. You know, why would you put yourself through that? So, and well, for now, we have low unemployment. That may change. Maybe all those Twitter workers will become nurses. You know, I taught on Long Island, which is where I'm from, and I'll never forget, we had 10 students per clinical rotation. And I was on a maternity unit. I taught maternal newborn nursing. And I was on a maternity unit, and I walked into the maternity unit with 10 gray-haired men. They were former Grumman employees, the aerospace. And the nurses looked like, what are we supposed to do with these guys? Actually, well, they were awesome because they really do plumbing. So the IVs, oh my God, they were fabulous. I loved them. They were fun. But so I really do think there are some answers here. So little bright spots. Everybody knows this is a problem. So I mean, Bernie Sanders, I met with Bernie Sanders when I was a president of VONL years ago, and he was aware of this, that there were a nurse educator crisis. Of course, nothing has happened, but I think that it's at such crisis proportions. I think something is bound to happen. And even the state of Vermont now has a workforce task force stood up, and I actually have the URL for it at the end of this. You can read the report. And some of it is loan repayment. This killed me, though. I really had to Twitter about this. So average salary is $72,000, right? For a nurse. Average educator salary is $60,000. So already we're $12,000 down, right? We're under. And they were offering $1,000 tax credits to nurse educators. Whoop-de-doo. I thought, yeah, I wouldn't find that to be much of an incentive. So, yeah, but it was a nice thought. And academic practice partnerships. This excites me because there's a woman who taught here in the state and has since moved to New Hampshire, who is starting one of these liberal arts college programs from the ground up, and this is what she's doing. She's really making this a partnership with local hospitals, and I can't wait to see how things go. I'm really anxious to see how it works. Her students are going to be right out there with preceptors right from the beginning, and working at the same hospital all the way along. So I'm really, she's a clever woman, and I'm really excited to see how this works out, because if it does, it may. Preceptors, I'm sorry. A preceptor? So you can have a clinical instructor who's with like 8 students. Or in some schools, especially in Oregon, they've really made this model work. There are dedicated education units in hospitals where every one of the nurses is a preceptor. They actually work directly one-on-one with a student. So the student might be in clinical for 3 days a week with this preceptor. They get paid extra, but they usually get paid extra by the hospital, so that the school isn't the one directly paying for it. And that's where the partnership piece comes in.
The hospital's putting money toward their future nurses.
Yes. Yep. I think for quality, I mean, we really have to stop remote testing, especially for nursing students. Just had this conversation this morning with a school, and they're just, I thought the dean was going to cry. She's just so upset. You know, I don't know why, you know, the administration won't let her do that, go to all in-person testing, and she was so upset. So I think we gave her some fodder. combat grade inflation. One of the things that I've offered is we have this anatomy and physiology test that we can offer to programs, and we say, so have them take this LPN level anatomy and physiology test, and if they really bomb it, go back to the science faculty and say, can you explain this? So that's great data, right? So that's we're fighting some of it with data. And in terms of quantity, I think we do have to work to reverse the social media stigma out there right now and encourage young people to go into nursing and healthcare. I have been doing this for 37 years now, and I went to school to be an actor. That would have got, do you want French fries with that? And, it was a wonderful 4-year degree, a heck of a lot of fun. But I was never going to find a job. And so I went to nursing school to be a nurse midwife, but then found out that I really loved nursing. And it has been tremendously fulfilling. It's, I wouldn't be who I am today. I don't think I'd have the kids I have today if I wasn't a nurse. I know it's really valuable to my family. I've nursed 4 people to their deaths very peacefully in our front parlor room at home, and it's invaluable. It's a wonderful thing. So, that's one thing that you can do too. It's a grunt thing at first because you have to work in the hospital, you have to do shift work. But once you're over that hump, becoming an advanced practice nurse, informatics is an interesting field. I probably would have gone that direction. That's really computers and nursing and improving data management and manipulation and gathering. The sky's the limit. There's all kinds of things you can do with nursing. So, and health careers in high school, it's not all doom and gloom, because I can tell you in the early 1990s, we were facing another workforce crisis, and the state of Vermont stood up a Blue Ribbon Commission to really look hard at the problem. And it was nurse educators, nurses, all kinds of folks from all over the state. And the recommendations they made were part of what started the Hannaford Health Career Center. So, there really are things we can do, so to encourage. And I'd encourage you all to take a look at that workforce. I know it's boring as heck, but take a look at that workforce recommendations and call your legislator and, encourage them to fund, that $1,000 tax credit. And also to Bernie Sanders, the more he knows that people are anxious about this and interested, the more attention he'll pay to it. And he is interested, I know that. And also improving working conditions for current nurses. I don't know what we're going to do about the traveler thing. So, but that's the URL. And I just actually talked about all this. So that's what I've got. I should end with a tap dance so you're all smiling instead of gloomy. It's kind of scary.
How do you expect to reverse the social media?
How do you expect to reverse the social media stigma? I think it's already happening, believe it or not. I was on Instagram today, just flipped through it today, and I saw something about happy nurse or something, and so I'm going to explore that when I have a minute. But I have a feeling it's like a way to get around that, to counteract that, I should say. And I can tell you, in my company, we're writing letters to our CNO. Just got a letter published in the New York Times about this. We're trying to get the word out. So, because we're all nurse educators that work for the company, and we have a national voice, and I think it's important. So, hope you do too. Yes.
Where do you think we're going with the travelers?
Where do you think we're going with the travelers? I don't know. I know the salaries have declined, so it's not as attractive. But I think hospitals have to come up, if they want people to stop doing this. So unless and until, I really don't. I'm glad I'm not a hospital administrator, I'll tell you that. That sounds unpleasant.
I just don't see why during the pandemic they didn't just give disaster pay to the ones they had to keep them. I just couldn't understand that.
Why they didn't give disaster pay to the ones they had.
They got
Traveling nurses.
Get traveling nurses.
Well, they were down to start with. So, I mean, they were using travelers at UVM. In my travels, I remember going to University of Rochester at a hotel right by the university, and I was in the elevator with a couple of travelers, and they were working in the OR at U of R, at Strong Memorial Hospital, and so that was before the pandemic.
Yeah, at UVM, I know my
Yep.
parents were living in South Burlington in the 2000s and had to use UVM services a couple of times. And I met several travelers there then, so they were already.
Yep. So we've had a bit of a nursing shortage to start with.
The hospitals increase their salaries so that we could attract more and keep more. I mean, that should have been an early sign
Yes.
to them.
Yes. That would be the letter to Bernie. Yep. Yeah, I hate to think about it. Yeah. We're all going to be paying more in healthcare premiums. Yeah.
I'm not saying we should be, but
Right.
somebody's got to.
Yep. Yep.
Has there been any discussion about administrator salaries versus what the people who actually do the work?
Has there been any discussion about the disparity between administrators' salaries and the people who actually do the work? I don't know. I'm not sure. I'm in education, so I don't. I don't know. No, that'd be interesting.
I mean, there's a profit motive even in the nonprofits, and where they can squeeze is in the rank and file. The docs, it's a little hard because they demand a certain salary or they don't show up. And
That's right.
those have to be-
And they bring in the business. So it's the business model as it is. One of the things that that interests me, because being in business, I've seen the other side now about profit and loss and revenue and all those things. So I'm interested in that. So I actually did a talk for I used to work at Excelsior College in New York State called "Follow the Money." And I think it's really important. I don't think nurses realize healthcare is a business. Their hospital is a business. They sort of look down their noses at nurses who work for vendors, but you do too. So, and unless you think like that, I think you're not going to see your worth. There's also a gender issue here. I heard, and I don't know if this is true, that men in nursing are actually getting paid more than women, that on average their salaries are higher. And I think it's our fault. It's our fault for not demanding more. I taught my daughters, always ask for more. Whatever they throw at you, always ask for more. So they do, and they usually get it. So.
How many men are nurses versus women?
About 9% now. Used to be more like 5, but about 9%. Yep, yep. So actually that's a good thing because they won't work for peanuts.
As long as the women can demand the same amount,
Right. That's right.
which is difficult across the board, of course.
Yeah, for lots of reasons. Yeah.
Well, Brumstead, who's the head of UVM Medical Center, he's earning $2 million a year.
Oh, for crying out loud.
It just seems like out of control, and a lot of people on one care board are earning like $400,000 or whatever. And the governor just hired a new president of the Green Mountain Care Board, Owen Foster. He's one of our people in Addison County, and I listened in on one of his sessions with One Care, and he was hammering them on the salaries, and I had a hope that he's going to do something. I don't know, he just started, but it's really ridiculous the amount of money the CEOs are earning compared to everybody else.
Yeah, so this is another comment about the disparity between what administrators and CEOs and One Care Board in Vermont is making as opposed to what the folks at the bedside are making. And that's true in so many industries. It's kind of true across the board. So.
Except that it does reflect in our premiums, and then Vermonters can't afford health
Right.
care. So
Right.
I mean, it really has a direct effect on us.
Absolutely. I'm with you, but I don't know how to make that happen. That's for sure. But there are some at a certain point. That $2 million salary is unsustainable if you're paying $25 million a year for travelers because you can't get nurses, right? I love it. I think it's hilarious, quite frankly, that nurses have voted with their feet and said, yeah, well, I can make a lot more elsewhere. Working here.
It's not a great life.
Oh, it's not. It's uncertain, and you've got the angst, the anger of the people around you, Yeah. Any other thoughts? Well, thank you. Oh, go ahead.
I'm
Linda,
sorry, I
no,
haven't
go ahead.
told.
No.
One of the things is I was told, we have a real shortage of primary health care providers in Madison County. In fact, you can't get into, a new patient can't even get in. It's like 6 months, and then our federally qualified health center in Bristol has almost a year waiting list for new patients. The fastest a new patient can get in is in Brandon at the Porter UVM primary care center. So it's really bad. We have a real shortage. And I was just thinking if we could get more family nurse practitioners hanging out their shingles and working, that we could really help that. But I don't know what's happening at UVM or what's happening at that level of training.
I think that there are a lot of nurse practitioners in schools. The question was about what's happening in the state in terms of advanced practice registered nurses. But it's really daunting to start your own practice. I mean, a lot of physicians won't do it. It's a lot. So I think hanging up a shingle is probably not the way most nurse practitioners would head, but at least to get hired at a practice, because you will make less than the physicians that are there. But still, it's. I mean, I see a nurse practitioner. There are a lot of nurse practitioners around, but as fast as they graduate, they get scooped up, and I don't think we can produce enough of them either.
How are they graduating?
I don't know. I'm not sure. I really do stick to pre-licensure, so I'm not sure. Yeah. But there is a big problem there. Yes?
Are nurse practitioners able to practice on their own, or do they have to have a doctor with them, or are they in an office that has a...
In the state of Vermont, as I recall, this changed within the last 10 or 15 years, they can practice independently, but that's rare. Very few states allow that. Mostly it's at least you have to be affiliated with a physician, but I think they can. I could be wrong about that. It's funny, I don't remember very much.
Middlebury has one, Laura Wilkins.
Oh, that's right. Well, no, she practices with isn't she? Yeah, with a physician. Yeah.
She had her own practice.
It's possible. She can. I think she can. Yeah, they can prescribe, diagnose, treat, and prescribe. So PAs, physician assistants, can't. They have to work under the auspices of a physician. So
much of this seems to go back to basic education and basic discipline as far as cheating and things like that. It's starting early on. It just keeps manifesting itself and going on. So much of it has to go back to these very basic ideas in schools that you don't pass kids because their parents are demanding or things like that. It seems like we have a tendency to cave in when there's any pressure like that, rather than standing up and saying, no, there are boundaries that we expect.
Yep. The comment is that this seems to move back, all the way back to all of the students who get passed through elementary school and beyond in high school and perhaps cheat or get their parents make sure that they get passed on. And I agree. I think this is a brave new world we're in. They tend to work together. They've done a lot of that in elementary and high school. They've worked as a group. And so they think that that's okay once they get into nursing school. And it's possible that the NCLEX, the licensure exam, is the first time any of them have been told no. I mean, that's possible. So, my company gives standardized exams for different content areas, so they could take a standardized exam all the way through. That's nationally based, all the way up to the end. And what I see is these schools that are passing students that cannot pass our standardized exams that are nationally benchmarked. So, how are their students passing their courses? What's happening there? If they can't pass our exams, how are they passing that, maternal newborn course at College X? So.
It's also a generational thing. Who aren't really that interested in working very hard. And it's really kind of pathetic.
I know. Somebody just told me the story. It was really just a generational issue with just attitudes towards work. Somebody told me the story that she heard from a nurse, a CNO of a hospital, that one of her graduates came in to apply for a job and said, "But I really don't want to work nights and weekends." What were you thinking?
Oh my God.
That's what
in a nursing
nurses do.
job, yeah.
Mind-boggling.
And I think it's, they're the center of the universe from the day they're born. They don't have to work very hard. So we need, like you said, it needs to start at the beginning.
Yeah, and the pandemic didn't help it at all.
Oh,
No, for sure not.
I mean, it definitely, but we can't keep blaming everything on the pandemic forever either.
Right.
We have to get beyond it and try to get back on track.
Now, mind you, there are lots of earnest, hardworking nursing students who are doing brilliant work in school and are going to come out being wonderful. Fabulous nurses. I have had the pleasure in my life of educating some remarkable human beings. And I run into them, which is always a tremendous thrill for me. So
I just need to clone them so we get 200,000 a year.
Work on that one, Mary.
Are you bringing in any nurses from other countries, Philippines, or is there any movement like that?
When this kind of thing happens, always. But they struggle taking the licensure exam. So they don't pass in this to the same degree. In fact, when the National Council of State Boards of Nursing publishes the pass rates, they publish foreign graduated nurse pass rates, and they're always very low. So those students have a lot of trouble.
Is there some way we could train them up as they come in? We
Yeah.
can get them up to speed
Yep, there are programs like that. Yep.
in Vermont?
I don't think so. No. So there are barriers there. There are interesting issues there. Cultural issues about healthcare and families that make it difficult. So, yeah, it's tricky. We have plenty of wonderful people here in the U.S. Not that I'm nationalistic or anything like that, but I just wish more young people were looking at jobs like this that are fulfilling. Yeah, right now they're not high paying. Eventually it probably will be better. And the sky's the limit on where you can go. So.
Interestingly, the last speaker series we had was Let's Grow Kids. And it makes me think, Maureen, that, we need to even start sooner than our physical schools. When we start with little ones to start instilling some very important things that will help them all the way.
Mm-hmm. They don't see many nurses, right? Children don't see many nurses. They probably see med techs and doctors in the physician's office if they, go at all, but very often. And so they don't get to see nurses.
And so many schools don't have full-time school nurses anymore.
Especially in Vermont.
And we have a wonderful school nurse that's part of our group, Mary Gill, I mentioned. Mm-hmm. And she was a terrific mentor and everything for kids at our school. But I know that that's not the case across all schools. Mm-hmm. But that could be a way to at least maybe encourage careers in nursing, is having school nurses help to talk about it. I don't know. Would be another
Nurse for every
direction.
school.
Yeah,
Chicken
nurse
in every
for-
pot and a nurse
There
in
you
every
go.
school.
Okay, that's what you can do when you retire. You get the
single already.
Well, thank you so much.
Thank you.